MK677 is basically like the growth hormone SARM goblin analog.
Warning!
You're watching Dr. Todd Lee TV, where theoretically you could learn a bunch of cool shit.
I'm Dr. Todd Lee. I'm a medical doctor. I'm an IFBB pro bodybuilder, and I'm a biochemist. And for these three things combined makes me the best suited person to discuss anabolic pharmacology on YouTube. Now, are there other smart motherfuckers? Yes, there are other smart motherfuckers. Is there anyone who has this confluence of skills? No. So I think my opinion's the best, but that's how everyone feels about their opinion. So hopefully you will find my opinion helpful, but feel free to check out other smart people like Dr. Dean St. Mart or Vigorous Steve. They really know their shit. I am not going to give you a comprehensive molecular weight blow by blow of growth hormone. I've done that a million times. I've got tons of videos about growth hormone, and I think I've got the best content on growth hormone on the internet. As far as MK677, I don't really cover it because it's kind of a joke to me, but there are people like Steve who will have probably a 55-minute video about MK677, and it's probably a great resource. So check out Steve's video about MK677. I'm going to basically break it down like what I think, my opinion, based off of my experience, both my personal experience and what I've seen in others, as to what I think. Why would you ever use MK677? So MK677 is classified as a SARM. It is not a SARM. It's a growth hormone secretagogue. Unlike a lot of the other growth hormone secretagogues, it's oral. It also supposedly works through different mechanisms, whereas most growth hormone secretagogues are either a ghrelin agonist or a growth hormone releasing hormone agonist. This one is a ghrelin agonist that somehow has some backdoor effect that generates a few other pathways. For this reason, MK677 is my absolute favorite secretagogue. However, I think secretagogues suck ass. Now, why? Why would I say such a thing? Because when the fuck does someone want to be super hungry? Well, there are some people that want to be super hungry, and that's when you would use MK677. I wouldn't use MK677 as a growth hormone secretagogue. I would use it as an appetite stimulant. If you need food, if you need to grow, and you can't eat enough to get any type of appreciable weight gain, remember, there's no reason to bulk. You should eat slightly above what you think your maintenance is. And for more about this, watch my episode, Advanced Discussion with Scientific Snitch, The Autopsy of Bulking, where I just am along for the ride. I'm there for comic relief while she's smart. And she basically explains with graphs and charts why bulking's dumb. Simply put, eating in a surplus doesn't necessarily grow muscle faster. It does grow fat cells faster. The more fat cells you have, the less leptin you'll release, which means the more ghrelin you'll have, which means the more appetite you'll have. It's a downward spiral. What you could do is instead use a synthetic ghrelin like MK6 to stimulate appetite in the instances when you need more appetite. And that's all I really see as an advantage to MK677. Some people will say that you get more insulin resistance from MK677 than you do from the growth hormone itself. That growth hormone indirectly can cause insulin resistance. I have not seen this, and I think...
Greetings, Earthlings! Like, subscribe, and share this video. Share with a friend. Share with enemies. Share with people who think they know everything. Spread it like herpes. Speaking of herpes, I am a medical doctor, and I could be your doctor. Click the link in the description box. I can order you blood work. I can read the blood work. I can treat any illnesses. Basically, it's like an HRT clinic that's a one-man army. Also, I do coaching. Dr. Karina Dodson and I have a coaching business called Apex Coaching. So if you sign up with me, you get coaching, which is nutrition, programming, competition prep, or lifestyle coaching, as well as all the medical stuff. So you have two doctors in one business. It's going to be contest prep, the nutritionist, the programming person, and the doctor all in one. You can't beat it. It's integrated. It works the best that way. You'll love it. Make sure to do it. Click the link in the description box.
This is kind of like a misunderstanding. I think people use growth hormone when they bulk, and because they're bulking, they have insulin resistance from bulking, and they falsely attribute the insulin resistance from the bulking to the growth hormone. I've never seen people who use growth hormone in a contest prep that are insulin resistant. So I don't think it's very much of an impact, but people report that there is a significant insulin resistance from MK677. Since I don't understand mechanistically how that works, I only care about mechanistic data. I don't really give a fuck about outcome data, because outcome data is usually bullshit, because it's usually retroactive people attributing things to the drug without knowing what the fuck they're talking about. So I don't see any valid logic whatsoever that MK677 has an independent method of insulin resistance, that if there is insulin resistance, it's through the growth hormone secretion, but your body's never going to secrete more natural growth hormone than your insulin resistance would be able to handle. It just doesn't make any sense. So in the end, I just ignore all that. Maybe Steve has some explanation on his channel. I don't give a fuck to even look it up, because it just seems so goddamn dumb. It's almost like, does pink unicorn's fart smell like cotton candy? Well, the guys on the internet say that it does. It's like, I'm not convinced that there are pink unicorns, and I'm pretty sure I'm not going to go out of my way to smell its farts if I found a pink unicorn. So the way that it's going to interact with my life is nothing, so I don't give a shit. That I would never stop using growth hormone just to use MK677. That it would be something that you would add in MK677 to increase appetite. Most people would just take edibles, like they would just smoke weed. Now, I've had some teenagers who say that they use MK677 because they don't want their parents to find out that they're going to use steroids, so they're going to use SARMs instead, and they think MK677 is a SARM. So MK677 is basically like the growth hormone SARM goblin analog. The whole fucking thing is a joke. It's not that I disrespect people for using it. I've used it before, and that was because I thought that naturally induced growth hormone would get all the benefits without any of the risks. And now that I understand more about the cancer risk of growth hormone, that it's really just through IGF-1, and since anabolic steroids stimulate IGF-1 also, that you're not getting around, you can't take anabolic anything. You can't grow your muscles without growing a tumor. If you have the tumor, it's going to grow because you're growing your muscles. Even lifting weights, even eating protein, everything you do that's going to help you grow muscles is going to grow tumors too. So you can't divorce the two. If you have latent hidden cancer, you're growing it by trying to be a bodybuilder. So the idea that you're going to use MK677 and avoid cancer, but growth hormone causes cancer, it's idiocy. You're just using a very expensive, weak version of growth hormone that's indirect and has the extra side effect of massive appetite. So unless the side effect of a massive appetite is what you're looking for, then you wouldn't use MK677. Obviously, almost every girl I know, I tell them, do not use MK677. You're just going to eat like a pig. It increases appetite, not hunger. Remember, appetite is the emotional craving for tasty food. Hunger is the absence of nourishment. So when you, at first you start getting hungry, you think about a steak or potatoes. And then if you go long enough, you start thinking about pizza. And then you smell ice cream and you just have to have it. That's appetite. That the longer you go, the lower your blood sugar, the more your body wants you to have a combination of sugar, salt, and fat. The hyperpalatability triad is the fastest way to spike insulin, the fastest way to store body fat. This is what MK67 makes you target. It makes you basically a pregnant chick. You target the most fattening shit you can find on MK677. It's not going to make you go for healthy food. It's going to make you get fat as fuck. So I don't like it. People are going to be so mad in the comment section. MK677 saved my life. You're an idiot. You call yourself a doctor. MK677 performed surgery on my sister's brain. And without this MK677, she'd be a bigger retard than you. There'd be so many comments in the comment section about people who are just on MK677's nuts. And I don't know what the fuck I'm talking about. I've used it. I've used growth hormone. I like growth hormone more. If you don't like it, go fuck yourself. That's the way it's going to be. Anyway, toodles. May the force be with you. I'd like to thank our sponsor, Fusion Regenerative Therapies, where I am the Director of Human Performance. This is the practice in which I practice medicine. we'll be able to order you blood work and read your blood work and help you with therapy as needed based upon the results of your blood work. Please click the link to get a consult with me, and I can help you optimize your performance. Thank you.